Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, I'm Ima from Department of Clinical Pathology, Faculty Medicine, Mataram University, Indonesia. Together with my team from Faculty of Medicine, Mataram University, we are very happy to have this chance to present our study about the trend of hemoglobin level in patients with chemotherapy and nasopharyngeal cancer. Well, on this presentation, first I'm going to talk about the background and aims of this study, then methods of this study, result and discussion, and the last one is the conclusion. Nasopharyngeal cancer is a malignant tumor that attacks the epithelial cells in nasopharynx. This cancer has a strong association with Epstein-Barr virus infection, as well as a strong tendency to metastasize to regional and distant lymphatic organs, as well as chemoradiasensitive. This cancer is endemic in Asia, especially in Southeast Asia, where the incidence was more than 30 cases per 100,000 population. There were around 6.2 per 100,000 population in Indonesia. Treatment of NPC depends on the severity of cancer itself, but in general, the management of nasopharyngeal cancer includes surgery, radiotherapy, and chemotherapy. However, chemotherapies have several side effects due to its potency on destruction of normal cells with fast regenerating cycles such as skin cells, hair cells, and hematology cells. This cancer causes inflammation of the oral mucosa and mucous membrane of the digestive system, pain, and reduces the saliva secretion, psychological stress, and dental abnormalities. Decrease of nutritional intake due to difficulty of oral intake, persistent bleeding, and persistent chemotherapy may lead to anemia. Chemotherapy reduces hemoglobin levels through a suppressive effect on bone marrow and a toxic effect on erythrocyte. Preclinical study shows that anemia is associated with the resistance to antineoplastic therapy, partly due to anemia's hypoxic effect. Anemia also correlated with ionizing radiation and some types of chemotherapy agents. Both depend on tissue oxygenation adequacy for their ability to destroy cancer cells. This study aims to determine the trend of red blood cells damage by assessing patient hemoglobin levels after chemotherapy. For method of this study, the study is a retrospective study using a secondary data which was taken from medical records at West Nusa Tenggara General Hospital. The data collection using total sampling from patient who was diagnosed as NPC and chemotherapy was given. The data will be collected on the period 2017 until 2019. The stage was defined according AGCC 2018. The hemoglobin level was measured by using the routine hematology analyzer and available on the medical record. The data obtained then analyzed with SPSS software to explore the trends of the mean hemoglobin levels in patients with NPC who received chemotherapy. The difference mean of hemoglobin levels in each cycle of chemotherapy was analyzed by repeated measurement ANOVA test. Result and discussion. So here's the table 1. This table shows the detailed data of patient characteristic of this study. So during this study, there were 94 patients with NPC, however, only 92 subjects who have complete routine hematology laboratory tests. The patient mainly male with the male and female with the ratio is 3:1. Particularly, the stage NPC on this research stage is 3 followed by stage 4A. Globally, the incidence of nasopharyngeal cancer is 1.2 per 100,000, which in men is 1.7 per 100,000 and in women is 0.7 per 100,000. Which this data shows that this case happens more in men than in women. In European region, there are generally less than 2 cases per 100,000 in 1 year among men and less than 1 case per 100,000 among women. While in China, Southeast Asia, and the Arctic region and among immigrants from these regions, the incidence was 30 cases per 100,000 in men and 10 cases per 100,000 in female subjects. Indonesia has around 6.2 cases per 100,000 population, with the number of new cases as many as 12,000 cases. The incidence of nasopharyngeal cancer is 2 until 3 times greater in men. This may due to difference in lifestyle between men and women. For example, alcohol consumption and smoking habit. According to the stage, the result of this study was comparable with the other research worldwide. Wang and Lu in 2017 was found the incidence of stage 1 until 2 was 35, which in percent is 26.9% patient, and stage 3 until 4 is 75, which in percent is 57.7% patients. On the other study found that according to the 650 participants, there were subsequently 4 or in percent is 0.6%, 59 or in percent is 9.1%, 429 or in percent is 99%, and 158 or in percent is 24.3% patient at stage 1, 2, 3, and 4A and B. So this graphic shows that the average hemoglobin level has decreased from the first chemotherapy to fifth chemotherapy and increased again at the sixth chemotherapy. The interesting finding in this study was the mean hemoglobin levels decreased from the first chemotherapy to the fifth chemotherapy, but the average increased at the sixth chemotherapy. Guo et al. Found in their study the mean baseline hemoglobin level was 14.1 gram per deciliter, which is from 7.5 gram per deciliter to 18.1 gram per deciliter. About 64 or in percent is 9.8% patient had anemia before chemotherapy, but out of 650 patients, the mean hemoglobin level during chemotherapy was 12.9 gram per deciliter, ranging from 7.5 gram per deciliter to 15.9 gram per deciliter. And the mean hemoglobin level after chemotherapy was 12 gram per deciliter with a range of 5.8 gram per deciliter to 12.2 gram per deciliter. So in this study, the mean baseline hemoglobin level was 11.51 gram per deciliter from 5.7 gram per deciliter to 15.5 gram per deciliter. After receiving chemotherapy on the 5th cycle, the mean hemoglobin level was decreased to 10.71 gram per deciliter from 7.60 gram per deciliter to 13.4 gram per deciliter. This mechanism could be due to chemotherapy's effect on hematologic cells. The compression of the bone marrow by chemotherapy agent will affect the hematopoiesis, including the erythropoiesis process. Monitoring the routine hemoglobin level is mandatory to be done before delivering the chemotherapy agent. Chemotherapy agent can suppress the process of hematopoiesis. Furthermore, the blood cell production will be decreased. The standard requirement of chemotherapy should be hemoglobin level more than 8 gram per deciliter to avoid tissue hypoxia. In the meantime, the body will lose many erythrocytes during chemotherapy. If the hemoglobin level was less than 8 gram per deciliter, a transfusion will be performed first. In the analysis of the difference in hemoglobin levels statistically, using repeated measurement tests, the results were not significant, which the p-value is 0.06. This was possible because some patients received blood transfusion which increased their hemoglobin levels prior to chemotherapy. As a result, the mean hemoglobin levels in the 6 chemotherapy cycles found in 11.57 gram per deciliter. Well, based on this finding, the conclusion is this study shows a trend of decreasing hemoglobin levels in nasopharyngeal cancer patients receiving chemotherapy, although it's not significant. The further research should be done to explore this phenomenon. Alright, that's all. Thank you so much for such a nice attention.